Have you been diagnosed with a voice problem, or you've noticed a voice problem and you've had some treatment, but your voice just hasn't got better? In this video, we're going to look at why some voices make full recoveries and why some just don't get better. Now, some issues that happen to the larynx and some injuries might cause permanent damage. For example, if there's a really severe blow to the larynx, that might alter some of the cartilages and the structures of the vocal tract and the vocal cords, and that will cause maybe a very long-lasting damage to the vocal cords. If there's no direct injury to the vocal cords themselves, the voice will make a good recovery. There are some conditions that aren't necessarily permanent, like nodules or polyps or cysts, or just muscle tension or inflammation of the vocal cords that's caused by laryngitis. All these things tend to be quite resolvable, given some time, maybe given some treatment. There are other issues where perhaps if there's cancers on the vocal cords, of course, that's going to lead to some surgeries that will probably alter the vocal cords a little bit or a lot, depending on the type of lesion they've had to remove. In those cases, there might stay permanent alterations to the voice to varying degrees. Of course, sometimes they have to remove sections of the larynx or total laryngectomies, and this will, of course, lead to no voice at all. Whole other systems where people learn to communicate differently. But if we're talking about just standard voice difficulties, mostly they will be quite transient. They tend sometimes to get worse or increase because people just keep using their voice and don't get the right treatment, but sometimes they don't get the right diagnosis too. And if you're somebody who's had voice issues and somebody has said to you, well, you have some swelling or you have some nodules or there's nothing there, but just take some voice rest or just have some voice therapy, and you've tried those things and the voice hasn't got better, it's very often worth having a second opinion, because over time things can change. In many cases, the person actually carries on using their voice to a very high level, or sometimes even being a bit vocally abusive, maybe shouting a lot, maybe going to loud concerts, having to use their voice a lot, going out a lot. And actually, when the voice is a bit compromised to start with, if you do things like that for too long, the voice, of course, will just get a little bit worse over time, and it will start to let you down a bit quicker, it will start to fatigue quicker, and then sometimes it will lead to pathology like nodules or inflamed vocal cords, perhaps new swelling, even if there was no swelling there before. In other cases, however, sometimes you get a person who's tried lots of voice rest, who's done all the things they're meant to do. They're telling me they're steaming their voice and they're drinking lots of water. And then when I ask them how long they've had the voice problem, they'll say something like, oh, about 5 years, 4 years. That's a long time to have a voice problem. And that's the first thing that should alert the therapist's ears to the fact that maybe something else needs to be investigated. It's either going to be the person's behaviour, they're just really not using their voice the right way, or they're using it in ways that are a little bit misusey to the voice, or there's something going on that hasn't been diagnosed. Sometimes it's something like a subtle scar, something that's easy to miss in the first ENT exam. And I've had quite a few cases like that over the years where the length of time they had the injury and the fact that the person is not very vocally abusive, or they're quite vocally compliant, but their voice nevertheless is very unreliable, doesn't last very long, keeps disappearing, is always something that alerts me to recommend the person goes and sees an ENT again for an updated ENT assessment, and also to check whether there's anything new or something that's been missed in the past. I had somebody recently who was told that they throat cleared too much and that's why they had this 5-year voice problem, but it really didn't ring right with me, and so had to send that person for further investigations. The voices and larynxes that don't have permanent injuries should make good recoveries with appropriate voice rest, a bit of behaviour management and some specialist therapy. And if yours hasn't, and you've been quite compliant and you've tried some things and followed some advice and quite a lot of time has gone by, then I would say seek a specialist opinion, and especially seek an ENT review to have your larynx looked at again. Sometimes it's playing detective when you're a voice therapist. You have to look at all the clues, and sometimes you have to go further back and say, well, how long ago did this start? Something that started a long time ago that hasn't really got much better, where the person is also not too vocally abusive. All these clues I put together, and then I know whether it's time to get a second opinion. And having a more fresh diagnosis sometimes will give you something that's been missed before, where you can adjust your treatment. And very often sometimes that actually might need a little bit of surgical help. So we try and put everything in place so that the client can make more of a vocal recovery by perhaps a combined approach. And just by knowing what's actually there so that we can work with that, work around it. It's usually not enough to say to somebody, just rest your voice and that will be fine. If you found the video helpful, don't forget to click the like button and subscribe to the channel.